Well, good evening. Welcome to the Medical Marijuana and Wellness webinar series. Tonight's topic will be medical marijuana, neuropathy and medical marijuana. A very important topic, one that can affect a number of people that have, dramatically. The tingling, the pain, the sensation is something that, it's aggravating, not to mention it's a lifestyle altering effect. We're going to have two people that we're going to have, I have a guest speaker, Terel Newton, tonight. Dr. Newton is someone who has done a lot of research in the area of medical marijuana and neuropathy. Terel, do you want to introduce yourself and say hello?
Yes, hello. Hey, Marc, can you hear me?
I can hear you now, Terel. How are you doing?
Great. I think this is a great continuation of a topic we covered last week where we talked about cancer. And so cancer is one of those things that can cause neuropathy, but also the cancer treatment can cause neuropathy. And that's something that we'll dive deeper into. So I think it's a great continuation of the previous presentation that we discussed.
Sure. And it's something that I think a lot of people are, how should I say, concerned about. So why don't we just dive into the presentation? And I do want to, I'll bring up a couple of key points tonight, but I do want to thank everyone for joining us. And more importantly, what I want to do is I want to point out that this webinar tonight is being recorded. We're going to be sending you an email after this particular webinar with a copy of the recording, which will be on YouTube, a copy of the slides for the presentation, any sponsored discounts that we have run into, speaker information, and extended resources. I also want to point out that tonight's presentation is really for information purposes only. It's not here to bring up medical advice, although we will talk about some of that. We ask you to please consult your physician for any medical advice, guidance that's out there. So now that we've got the formalities out of the way, Terel, let's dive into neuropathy. Tell me what neuropathy is and your thoughts on it. So what I'm going to do is I'm going to start by mentioning that neuropathy is really damage to the peripheral nerves that causes pain and numbness. You have a protective sheath, a protective coating on your nerves. It's a myelin sheath. And you can see as it starts to degrade, here's some pictures over here to the right. What that does is it damages the sheath. And when that sheath gets damaged, it causes sensitivity. In other words, when it gets degraded, it scrambles the cell signals, meaning that it leaves the cell in a position where it starts presenting symptoms like numbness, heat, pain, tingling in your legs, feet, arms, that type of thing. It's something that's really not very comfortable to a lot of people, and it's something that's very aggravating that's there. What types of neuropathy are there? There are really 6 different types of neuropathy. There are 4 different types of neuropathy. Probably the most common neuropathy that's out there is the neuropathy associated with peripheral what they call peripheral neuropathy. This has to do with the fingers, the toes, the hands, that type of thing. Also, there's autonomic neuropathy, which is something that harms the whole automatic process of your body, such as digestion. It really gets in the way of a lot of that. There's proximal neuropathy. This is part of neuropathy to the lower body, and often on one side of the body or the other side, meaning weakness in the legs. And then also there's the cranial and focal neuropathy, something that leads to visual disturbances, something that we see quite a bit. Areas that are affected are eyes, bladder, digestive system, heart, that type of thing, sexual organs, sweat glands. We see that happening quite often. Terel, I hope that you're able to connect back in because
Yes.
we get a lot of your comments. There we go. Why don't you make some comments on this, because this is really your slide. This is something that we've worked pretty hard on.
So when we talk about neuropathy, it comes from the word, so you have the word neuro, meaning neuron, and empathy, meaning pathology. So it's pathology of the nerve cell. And what makes it unique is very different from back pain, neck pain, arthritis, and that this can affect multiple areas. So patients can have this in their hands, their feet, their arms, their legs, and it can be a wide range of different type of symptoms that patients can have. Peripheral neuropathy is probably the most common type that we would see. It's very common in diabetic patients where they have pins and needles sensation from their feet that gradually moves up. Autonomic neuropathy is something that patients can develop a little bit more gradually. One example of that is if a patient is laying down and they go to stand up, their blood vessels don't adjust to that need for more blood in the brain. And so sometimes they could have dizziness when they stand up. That's because the blood is pulling down in the feet by gravity, and their nerves don't respond fast enough to control the blood vessels to squeeze and make the blood redistribute. Proximal neuropathy is a little bit less common. That's really more of the, more the trunk and more the upper part of the legs. Focal and cranial neuropathy, that's also a little bit more rare, not quite as common, but there's cranial nerves. So there's nerves that come out of the brain. And with these, you could have disturbances such as vision loss, problems with smell, problems with taste, and even chronic pain. So those are different nerves that affect the face and the head.
Sure, let's look at that. So what's interesting is when you take a look at the terminology, we talk about neuropathy, but there's different terms that people use for it. Can you kind of explain, because people hear about it as different from different words?
Right. So this might look like a lot of complex words, but each one can be broken down into 2 or 3 parts to get the exact meaning. So when we look at hyperalgesia, hyper meaning high, meaning elevated or increase, and then algesia meaning pain. So they have basically increased sensitivity to pain. And with these different symptoms that you have, it's like you press on a patient's hand or finger and it's very painful. I mean, even if you do a moderate pressure. Hyperesthesia, think of sensation. So they have basically an overactive sensation. So, this could be something that's often seen in cranial neuropathies and basically where someone's face is very sensitive to touch. Hyperalgesia, again, hypalgesia or hypoalgesia, hypo meaning low. That means that a low sensitivity to pain, very common in diabetic neuropathy. So if somebody has diabetes and they can lose the pain sensations in their feet, so they could actually step on something that cuts their foot and they may not know it because they have a reduced sensitivity to pain. That can be very dangerous because the foot can get infected. So hypoalgesia is really bad, just like hyperalgesia is really bad. For hypoesthesia, basically they have a decreased sensitivity to touch. So if you think of how our touch receptors usually respond when you can feel someone touch you lightly, for this, they have difficulty with grip. So if you're grabbing something and you can't feel that you're touching it, you may be prone to drop objects, even though you may not have weakness. It's just that you've lost the sensation of fine touch. Neuralgia just means nerve pain. Neuro meaning nerve, algia meaning pain. Neuritis means nerve inflammation. Itis is the inflammation. Dysesthesia is kind of a different term compared to the other ones. This is more along the lines of if you touch someone, but they feel burning, they feel pins and needles. Dys means like not, so they don't feel the proper sensation. Paresthesia is just like an overall numbness or tingling sensation, not necessarily always painful, but just a numbness, tingling. It's a disturbing feeling, but it may not necessarily be severe pain like a stabbing type pain. And in vertigo, that can be seen where nerves control our balance. And if the nerves are damaged that control our balance, the patient can have a spinning sensation. So they feel like the room is spinning. And this could be very difficult to control when they often take different medications to calm down the nerves, and things like Valium, Antivert, and different nausea medications.
Sure. So let's talk about the options that they have for neuropathy. Why don't you explain those?
Usually when someone is diagnosed with neuropathy, they'll start with physical therapy. And there's many types of different modalities of physical therapy. So when you think about heat, cold, massage therapy, there's even signals that you could send to the nerves to stimulate regeneration. That's called neurogenics. We actually have that at my office there in Jacksonville. Injections are things like nerve blocks. And that's often done to reduce the nerve pain and also help diagnose which nerves are causing the pain. There's different traditional medicines, things like gabapentin, which is Neurontin, and Lyrica, and then other medicines that are anti-epileptic drugs or antidepressants, which those can have serious side effects. And then there's supplements. ALA is alpha lipoic acid. B12 is a supplement often used because B12 deficiency can be a cause of neuropathy. You often see that in things like pernicious anemia. And magnesium is often given because magnesium calms down nerve activity. So where there's nerve destabilization, magnesium can help to calm the nerve activity. We think about plant-based medicine, which we'll get a little bit more into, and then surgery. So if the neuropathy is due to a nerve entrapment syndrome, patient may have surgery to release the nerve entrapment and the impingement.
Interesting. So these are the different options that you would have. Let's talk about where medical marijuana comes into play. Let's talk about medical marijuana as a treatment for neuropathy.
So this is more along the lines of medicine and basically plant-based alternative treatment options. So with CBD, which is a cannabinoid, so this is from the actual plant, but we do have a type of cannabis in our bodies. The CBD has been shown to be an anti-inflammatory, and actually the National Institute of Health has a patent on cannabinoids to protect the brain from traumatic brain injuries. And part of that is by protecting the covering around the nerve cells and protecting the nerve cells by reducing inflammation. And so CBD acts as a neuroprotective agent, or in the patent, it refers to it as a neuroprotective antioxidant. So that's how it's actually protecting the nerve cells, by reducing the stressful environment of the nerve cells.
Interesting. That's interesting, because that really can help, can provide a large amount of relief. So let's talk about how THC, why don't you tell me a little bit about how THC and CBD affects neuropathy?
Now, this is a situation where you combine the two to get the optimal outcome. So when we look at and talk about CBD, CBD it's a good anti-inflammatory. It works by several different mechanisms, but THC is much stronger. And when patients are dealing with pain and having problems with sleep and muscle spasms, THC can be a very potent pain reliever. It can be as potent, and in some cases more potent, than opioid medicines without the side effects of the opiates. So when we look at this list here, it talks about the mechanisms. Okay, how is THC working in order to reduce the pain symptoms? So when we look at the electrochemical reactions, so the receptor, so this is actually where the pain signal starts, is at the receptor, and then it goes through the nerve cell into the brain. And so it interrupts the pathway where it's entering the spinal cord even before it goes up to the brain. So this is two areas where THC can act even before the pain signal gets to the brain. At this point, it's about to enter the spinal cord. When THC is used as an anti-anxiety agent, when someone is more relaxed, they don't feel bothered by the pain quite as much. And not only that, THC is an anti-inflammatory as well. So it's basically working on the nerves directly. It's working indirectly by blocking the pain signals, helping anxiety, and then it's working by another mechanism indirectly as an anti-inflammatory. CBD, the most potent way that it can work is as an anti-inflammatory, and it's stronger milligram for milligram than aspirin and hydrocortisone, but it also acts on serotonin receptors. And so this is an area where you can get improvement in anxiety, improvement in PTSD, and improvement in sleep as well. And so all of these are associated with pain, because pain is an unpleasant sensory and emotional experience. And so this is one of the unique medicines that can not only treat the sensory, the actual pain, but it can treat the emotional association with the pain and help someone accept it and actually sleep better, have less anxiety, feel more relaxed, and even increase the overall well-being and help the patient maintain homeostasis.
Now, I think that, getting into being able to sleep more and feeling better is something that's really important, especially when you're suffering from something like this.
And not only that, I was going to say this is much safer than other sleep aids, because THC and CBD, they don't have receptors in the brainstem, so they're not going to suppress the patient's breathing when they're taking it at night to help with sleep, as opposed to many of the other medicines which can combine. You always hear about this recommendation: don't take your medicine with alcohol, and that's because alcohol suppresses your breathing, and you may take a prescription that's also suppressing your breathing, and when you combine those, unfortunately, there could be devastating consequences there.
Sure. Let's talk about CBD and THC from the standpoint of as a treatment. What do you recommend, or what are we seeing from what is the science recommended?
So this is a little bit more detailed than what we discussed on a previous slide. So high CBD reduces inflammation. It lowers the production of cytokines, which is anti-inflammatory markers. And so, how do we combine the CBD and THC? One way is to have a high ratio of CBD. So we have much more CBD than THC. So such as a 1 to 4 product. So that means 1 part THC, 4 parts CBD. or 1 part THC and 20 parts, 1 part THC and 20 parts CBD. So for every 1 milligram of THC, you have 20 milligrams of CBD. So that's a high ratio CBD product where the patient can get the benefits of THC being there. However, they reduce the side effects because CBD helps lower the side effects of THC, things like paranoia, dizziness, problems with memory.
Yeah.
However, sometimes patients increase that ratio, so they need a 1-to-1, so equal parts CBD and THC. If they don't get benefit from that, they may have to go to one where there's more THC than CBD. So THC can come in a high ratio. So THC is 20 milligrams to 1 milligram of CBD for patients that have tolerance and that are dealing with severe pain, and they've tried other ratios that have failed.
Right. But I think you have to have a pretty high tolerance to THC to be able to head in that particular direction. You may have to go to a 10-to-1 or something like that if you're very sensitive to THC. Is that correct?
Yeah, you would have to have a high tolerance, or you would have to basically microdose. So take a very small dose, a few drops at a time. Give yourself, 20, 30, 40 minutes to see how you feel before taking another dose. And so you can microdose, take a little bit throughout the day.
Great. And then when you put both of them together, CBD acts as a regulator for THC, meaning what it's doing is it's really helping to offset a lot of the potential high that you'd get from THC and really brings out the medical benefits of both of them. Is that correct?
And so when you combine the two, you have tremendous benefits where you're getting the benefits of both, where they're both present. And when you look at this diagram here on the right, there's a tremendous number of types of medical conditions that this applies to. And we'll dive a little bit more deeper into that. And part of this is because we have this endocannabinoid system that is present in our brain, is present in our spinal cord, and all of our organs. So this is where we can have improvement in many different types of disorders, even though this is one type of plant-based medicine, these phytocannabinoids.
Sure. Now, let's talk about that for a little bit, because you brought up an interesting subject. I think that since, I've heard about the nervous system for most of my life. In fact, I personally call the nervous system the cell phone system of your body. When you have a particular issue, the nervous system carries a signal up to your brain and says, Houston, we have a problem. But for many years, this is where Western medicine was. And it wasn't until Raphael Mechoulam started doing some work in medical cannabis that we found out that the body also has an endocannabinoid system. Tell us how that affects us, Terel.
Yeah, so, the reason that we haven't heard about this system for so long is because in the early 1900s, when we started prohibiting cannabis, we prohibited the research, and then all the research being done in the US was only associated with the side effects of cannabis, not with the benefits. So the benefits were being studied in other countries. And Raphael Mechoulam, he is really the grandfather of cannabinoid science. And so he was able to study these cannabinoids, and he found where they're working in our body. So we knew for thousands of years cannabis worked well as a medicine, but we didn't know how it was working.
Right.
But those discoveries led to us finding that we have a type of cannabis in our bodies. And this is why the medicine has been working so well for us for centuries. Right. And with this, the cannabis in our body is where one nerve is communicating with another, and that's our endocannabinoid system. And this includes part of our nervous system, it includes part of our immune system, and part of every other organ system in the body. And this is associated with helping us maintain homeostasis, or a steady state. So we're not too excited, we're not too relaxed, we're at a mellow physiologic level.
Right. Now, this is interesting because I should mention that Raphael Mechoulam is from Israel. And interestingly enough, the United States government, meaning your tax money and my tax money, started funding his research in 1964. So we as a country have been funding research for a long time. It's fascinating that we haven't been able to take advantage of it as much as other countries, but we're beginning to, let's just say, get enlightened as to the benefits of the endocannabinoid system and what it can do.
And so, we have done little research, but however, I will mention this. If you go to pubmed.gov, you can see that there's an exponential increase in research. And part of that is because now we have over 35 states that has cannabis available for medicinal purposes. And we also have the first FDA-approved medicine, Epidiolex, which is for seizure disorders, rare seizure disorders, is now in the market. So CBD has been rescheduled. And of course, we have the 2014 Industrial Hemp Act that was renewed as the 2018 Farm Bill. So you see different CBD products, hemp products now available for nutritional purposes.
Mm-hmm. So let's talk about our bodies, because you talk about the endocannabinoid system. Tell me the effect of, because our bodies produce endocannabinoids, and that's how it manages, mood, pain, health, our appetite. But really, phytocannabinoids have a major effect because they can actually help support the body. Tell us a little bit about that.
One major problem with our endocannabinoid system is they're made on demand. So they're just made when we need them. So when your body is stressed, one example is if you stress your body, let's say you're riding an exercise bike or running, after a period of about 20 to 30 minutes, you'll start to feel less pain. Your breathing will be easier, and you'll feel like you can go all day. And that's called the runner's high. And as your body's being stressed, it's releasing your endocannabinoids. Now, however, those endocannabinoids only last for a short period of time because they're broken down very quickly. Phytocannabinoids aren't broken down so quickly. You don't metabolize them as fast. So phytocannabinoids last longer in your system. I'm sure you might have heard how if someone's taking cannabis on a regular basis, it takes a long time for the drug test to be negative, right? And that's partly because it's oil-based, so it's stored in our fat. So even when you stop cannabis, you won't go into a withdrawal syndrome.
Sure.
But then the other thing is that the phytocannabinoids last longer. And based on the route that you take, you can adjust the length of relief. So inhalation, for example, with phytocannabinoids might last a couple of hours. If you take it orally, it can last 6 hours to 12 hours based on your metabolism. If you're taking like a RSO, a Rick Simpson oil, now that's a much more potent product. It could be in your system for 24 hours, even longer. And that's because the phytocannabinoids have a longer half-life. So they last longer in the body. They're not broken down immediately as soon as they're produced like the endocannabinoids are.
Sure. It's very interesting. Cannabis really provides a lot of support for the body function, because I think you mentioned to me at one time, our body as we get older doesn't produce as many endocannabinoids, or doesn't produce it as quickly to be able to address some of our issues. Is that right?
Well, just as we age, we have different neurotransmitters, different hormones that decline over time. Another example is for men, testosterone, for women, estrogen and progesterone. So sometimes our doctor will have us supplement those. The same can be true for endocannabinoids. When there is a deficiency in endocannabinoids, we can be at risk for fibromyalgia, irritable bowel syndromes, migraines, and different disorders. However, if we place the phytocannabinoids in place of that deficiency in the endocannabinoids, then we can overcome those symptoms. And over time, it's just part of the natural aging process where some of the functions aren't as efficient and we don't produce as much endocannabinoids, but we can supplement that with the phytocannabinoids.
Sure. But the amazing thing about cannabis is it has it really is made up of a number of cannabinoids. This is just a small number of them. But interestingly enough, let's walk through this chart. You talk about the entourage effect. You talk about the effect of the CB1 and CB2 receptors. With CB1, the THC receptors are primarily found in the brain and in the central nervous system. The CBD receptors are found in the core of your body and in the extremities. But Terel, tell me a little bit about how this affects. Here's some interesting things about the different endocannabinoids working together on things like inflammation. This is part of the entourage effect. Is that correct?
So in our body, we have two major endocannabinoids. For the plant, it actually makes over 100 phytocannabinoids, but we're not going to go over all of them. That's way too many. And a lot of them are not in high concentration. So we talk mostly about CBD and THC because those are the most prevalent ones, but there's many other cannabinoids that have a lot of medical benefit that work very similar to THC and CBD. And so with this, you can get a lot of small doses of various cannabinoids to have less side effects and better results. And so when multiple cannabinoids are present, that is the entourage effect. So where you have one cannabinoid being present, you add another one, and now they're working better together. That's called synergistic, when they work better together. And part of that is because multiple phytocannabinoids help with inflammation. Multiple phytocannabinoids help with reducing cell growth of cancer. Multiple phytocannabinoids help with pain. Multiple phytocannabinoids help with sleep. And so when you combine those, you get better results with lower doses of medicine.
Yeah. Here's an example of what the phytocannabinoids for cancer, for example. I'm sorry. And here's an example of how they work together for pain. And here's an example of how they work together for sleep. This is all part of that entourage effect.
This is the entourage effect, but this is just part of the story because there's a whole nother group of molecules in there that we haven't even talked about. This is just the phytocannabinoids. The plant is amazing, and it's actually the most versatile, most useful plant on the earth. And this is just part of the medicine that's in there, but there's a whole nother set of medicines that we have yet to even discuss so far.
Sure, we'll be able to get to that. So tell us a little bit of how this works. How does this THC and CBD work specifically for neuropathy or for our bodies?
So with neuropathy, as it relates to chronic pain, patients often deal with a lot of other issues along with the pain. They could be nauseous, they could be anxious, the pain can be associated with muscle spasms. And this is one of the few medicines that can address several issues at once. So if a patient is dealing with pain and they're dealing with nausea, by the way, THC is a great antiemetic. It was FDA approved in 1985 for nausea associated with cancer and cancer treatment, but it's an anti-inflammatory. It acts at the CB1, which is more at the nerve cell, and the CB2, which is more in the immune system. It's an antispasmodic, and it's a neuroprotective antioxidant. CBD, which was isolated even before THC, but we've only really talked about it more recently because there's been a trend toward a more natural approach because of the opioid epidemic. We need to find alternatives. We need to find different options for serious painful conditions. But it's also a neuroprotective antioxidant. It has mechanisms, how it works for rheumatoid arthritis, has different mechanisms of how it works to help reduce the spread of cancer, has mechanisms of how it boosts your body's own endocannabinoid system by stopping how you break down anandamide. So that's our most prevalent endocannabinoid. It also acts on pain receptors, serotonin receptors to help with sleep. It's an anti-anxiety agent, and it works on more than 50 other proteins, so receptors and enzymes. So CBD is very versatile. And the thing with CBD, you can continue to increase the dose and you won't see the side effects that you will with THC. So you won't see like the memory problems with dizziness and things like that. I'm not saying that there's no side effects. I'm just saying that you can more comfortably elevate the dose faster with the CBD compared to the THC.
Right. And you mentioned some of the other cannabinoids that are out there. Tell us about CBN and CBG, because both of them are very important.
So CBN is actually a non-enzymatic breakdown product of THC. So that's a fancy way to say that if you heat up THC, it can more quickly be converted to CBN, which as a sedative, a lot of advantages for sleep, a lot of advantages for pain. It's also an anticonvulsant and anti-inflammatory. CBG is really the grandmother of the other cannabinoids. So it's a precursor that can be converted through enzymatic processes in the plant to the other cannabinoids. It gets converted to CBD, to THC, other cannabinoids, but it by itself has medicinal properties that help with pain, help with depression, and also activate different receptors in the body to balance us out and help us achieve homeostasis.
Sure. That's really interesting. By the way, I might want to point out to everyone that's watching in, you'll see in the middle of your screen down here a little double bubble that says Q&A. Please feel free to ask questions. We'll be here to answer them. Terel and I would really like to get those out and get your questions answered. I know you must have some, and we're here to help. So let's please feel free. There's no such thing as a bad question. Please let us know, and we'll be more than happy to answer those for you. So Terel, let's talk about, you talked about THC and CBD and how it affects other receptors. Tell me a little bit about that.
So one thing about CBD is it not only interacts with the endocannabinoid system, there's other receptors. So a receptor is a protein on a nerve cell. So it activates different areas of the nerve cell and different parts of the brain to help interrupt the pain signal by multiple mechanisms. So A2A is an adenosine receptor, so that controls inflammation and circulation in the heart. GRP55 is associated in some instances with pain, but also blood pressure. So what we're talking about here is homeostasis. So we have inflammation, we have blood pressure, we have changes in body temperature. This is how we regulate it. The VR1 receptor, the vanillin receptor, this is one of the most common pain receptors. So it interacts with that to slow pain signals. 5-HT. This is one of the ways that it helps with nausea, also helps with anxiety, and helps with pain as well.
Right. So really, CBD is almost like a super. I'm using a very bad term, but it's like a super vitamin. It does more than just help with the endocannabinoids. It helps other receptors in the body to be able to help you regulate your body and really address a lot of the issues and the symptoms that you have.
And this is why the lists are so long. When you look at, what are the qualifying conditions for different states? Why are these lists 10 diagnoses long? Why are they like sometimes 15 or almost 20 diagnoses long?
Right.
And that's because CBD works by so many different mechanisms. It can help you achieve homeostasis in so many different ways. And when you combine that with the power and the potency of THC, you can get benefit in a lot of different situations, not just pain like we're talking about here.
Right. That's interesting. Now, the industry is going through a little bit of a change. I know that when I got involved in cannabis, I heard about indica and sativa. Now they're talking a lot about what they call cultivars or chemotypes. Really, that's a combination of not just the strain, but the cannabinoids and terpenes. Tell us a little bit about that, because that's something that's really in the last couple of years, this term has been used quite a bit. And I know a number of the viewers, when they go into the dispensaries, the people in the dispensaries will be using words like cultivars. Let's define that and help people understand that.
So when we talk about cultivars, sometimes we use the term chemovars. We're just talking about chemical varieties. So just think about the different chemical makeup, and there's thousands of different types of cannabis plants. So when you hear someone talk about, let's say, for example, a 9-pound hammer, or they talk about Blue Dream, or Sour Diesel, OG Kush, Pineapple Express. So when you test those plants, you get back a chemical profile of what's in it. And so you could see, okay, what's the THC content? What's the CBD content? But what else is in there? And so the other thing of what else is in there is often terpenes. And terpenes are aromatic compounds. So that's what gives cannabis the different scents, the different colors and flavors. And these also have medicinal properties. So when you combine those, the cannabinoids and the terpenes, sometimes we refer to that as strains. Okay, so strains is like, Girl Scout cookies or 9-pound hammer, that's the strain or the chemovar. But what you ultimately need is the lab test to verify what is actually in there. And so when you know what's in there, that helps you reach your sweet spot. So when you have a goal, let's say you're waking up with pain at night, right? So you want to hit a sweet spot to where you can sleep and not be in pain. So there you want something with a little bit of sedative properties and helps with pain. Let's say you want to treat pain in the daytime. So in that case, you don't want the sedative properties, you want the uplifting properties. So that's where the chemovar might be what we call a sativa. So that helps you hit your sweet spot in the daytime, because you want something that's going to help with pain and boost you up, but not make you sleepy. And so when we know about the chemical varieties and different options, that helps you reach your sweet spot much faster and much easier.
Sure. And a lot of it has to do with making sure you have the right terpene profile to match your particular, let's just say your what you're trying to achieve, the relief you're trying to achieve for whatever condition that you have. Here's an example. Now, these are not, as we mentioned, there's over 100 different terpenes that they're studying. These are the most common ones. These are very effective, especially for neuropathy. Explain how these work, because this is really the key to medical cannabis is the terpenes and the benefits you get from them.
Well, yeah, we need to hold our horses a little bit, because I don't want people to think we're getting too scientific here, because I want you to know that you've consumed terpenes. If you've eaten food, if you've eaten plants, fruit, you've consumed terpenes before. Now, there is a trick that you might hear about where someone takes mangoes before they take cannabis to make the cannabis stronger. And that's just because mangoes have myrcene. That's the first terpene that's listed there. And so, we're not trying to get too technical, but we're trying to explain, how is this helping? How are these different chemovars helping with different types of pain? How are they helping with sleep? And it's because of this list here. Now, we have THC, we have CBD, but when we can combine and add myrcene, we can have alpha pinene. They're also helping with pain, helping with inflammation. Because if you notice there, the first thing on that list with myrcene is it's an anti-inflammatory, but it's also a sedative and a muscle relaxant. So when you're dealing with pain, myrcene is going to be one of your best terpenes to help you get relief. And this is something that can be taken. It's mild enough that it can be taken in the daytime as well. And so it is in a lot of sativa strains. Alpha pinene is something that's kind of interesting. I don't know if you've ever heard, but this was in the early 1900s when we could prescribe cannabis that many patients had benefit in asthma. I don't know if you had heard that before, Mark, but
Yeah, I have actually. In fact, bronchial inhalers have a lot to do with that.
and this is why, because of the alpha pinene, it's an anti-inflammatory as well, and it's a bronchodilator. So if you can reduce inflammation and open up the airways, you can get benefit. Now this is not specifically a qualified condition in Florida or Georgia. However, this is more of a side benefit that you can get if you're taking cannabis for a pain condition.
Sure.
Beta-carotene is in cracked pepper, and most people have consumed cracked pepper. And I really love this one because it not only acts like a terpene, but it acts like a cannabinoid. So it works on the CB2 receptors to help reduce inflammation.
Mhm.
And it's also an antidepressant. So it helps stabilize mood. Limonene is another one of my favorite ones because that's really good for neuropathic pain. I would say put a star by limonene, put a star by myrcene, because those are going to be some of your more important ones, specifically for neuropathic pain. Limonene, even by itself, has really good properties for neuropathic pain, even outside of having THC and CBD. But of course, those are going to make it work even better.
Sure.
Humulene is in hops. It's an anti-inflammatory. Linalool is very interesting. So there's more than 30 species of lavender plant. And so when you take your aromatherapy and take lavender, linalool is the active ingredient in there. And so with that more than 30 species of lavender plant, you can supplement this when you take your cannabis. So you can take aromatherapy and your cannabis medicine. This is also a local anesthetic. So if you find it in a topical formulation, or if you can, talk to your doctor about mixing a little bit of that in your topical, it's a local anesthetic. It'll give you additional relief, especially if you're dealing with neuropathy of the hands or feet. But definitely talk to your doctor about that first. But it is a great local anesthetic.
And you mentioned something really key. Some of these are also found as aromatherapy.
They're found in aromatherapy and they're found in foods. So when you add cannabis, the ideal way is to think of a lifestyle change, right? So it's not just about going from pharmaceuticals to taking cannabis. It's a lifestyle. So you don't want to eat cheeseburgers and French fries and things that are going to promote inflammation when you're taking cannabis to reduce it as well. You want to think about the lifestyle changes. And this is a great way to transition into that. So you're adding the cannabis, you're replacing the pharmaceuticals, but then think about, okay, when I have breakfast tomorrow morning, what can I do to promote that health, to continue to reduce inflammation, to continue to be in the proper mindset, to not have stress. And so when you let your food be your medicine, this is one way to kind of start that process, start that conversation with your doctor.
Sure, that's actually a very, very wise counsel. And this goes back also to not only the cannabinoids and the terpenes, but also flavonoids. Tell us a little bit about flavonoids, because this is what makes up the cannabis product.
So flavonoids is very special, and that's because when you hear about the health, of drinking a glass of wine, it could be beneficial. No physician is going to tell you to drink alcohol, but what is in there is called resveratrol. So because the wine is coming from grapes actually have a potent anti-inflammatory, and it also protects blood vessels. So if you can consume flavonoids, it can really help the condition in a more holistic way. Another example is when you hear about an apple a day keeps the doctor away, and that's part of flavonoids, right? Because they're anti-inflammatories. Another example is red onion as an anti-inflammatory, very potent anti-inflammatory. Quercetin is in there. So these are different compounds. So we talked about terpenes, but there's other things that add flavor, that add spice, that add taste, that also have huge, tremendous benefits. And they're available in different levels in the cannabis plant as well.
Sure. And this is really why cannabis is so important, because I don't think there's any other plant that we know about that has the medical properties of cannabis. Is that correct?
Nothing else has the versatility, and that's because there's so many enzymes, and the genetics of the cannabis is very versatile to where we can even make hybrids. So we can have two different chemovars that's high in cannabinoids and terpenes and crossbreed those, and we can add, flavonoids, and there's a lot of different varieties that we can get.
Sure. And as we mentioned earlier, if you're using CBD with THC, the CBD helps to lessen the psychoactive effect of THC, correct?
One thing about neuropathy is the patients could be at risk for balance problems because they can't really feel their feet. So this is one advantage that we can take, and that CBD protects you from the side effects of THC. So when you start with a high CBD chemovar, a high CBD medicine, you slowly add the THC because you don't want a patient to have problems with balance when they already have problems with balance from the neuropathy.
Sure.
And the CBD is very protective against that. The terpenes as well, and it's in a different way because terpenes don't cause some of the dizziness and balance problems. They're not present in as high amounts as the cannabinoids, but you can still get the benefit and the relief from the terpenes and flavonoids.
Sure. And here's an example of some of the strains and some of the cultivars and the terpenes that work for neuropathy. But notice that the dominant terpene is myrcene. Is that correct?
That's probably the most dominant terpene that you will find in cannabis, and is present in not only indicas, but sativas and hybrids as well. This is the most important one of the most important ones for pain. As I mentioned earlier, limonene is also important for pain as well, and linalool.
Mm-hmm. And a cannabis strain like Cannatonic will have more than one terpene in it. It will have, for example, some myrcene, and it will have some beta-caryophyllene. Is that correct?
So the products will have a QR code that can be scanned, and you can see actually what is in the chemical makeup. You can see what's the concentration of myrcene, what's the concentration of THC and CBD. And these are just examples. Of course, each dispensary, each place is going to have a different profile for their catatonic, but this is just one example of what you can run into.
What I love is when people tell me I've tried cannabis and it doesn't work. All right. What's fascinating is they're really not matching the terpene that they need with the product that they need. They may be using a cannabis product, but it may not have the right terpene profile. Is that correct?
So with each dose, think about what is the goal of the patient. So if they're trying to take it at night for sleep, but they're taking a sativa, taking something stimulating, that's not going to work. But if they take something that's more relaxing and they have multiple terpenes, multiple cannabinoids that help with sleep, they're more likely to hit that sweet spot much faster. So we have to look at the goals of the patient and also what is the chemical makeup of the product. So for somebody that's new to cannabis, you want to have them start with more of a high CBD strain. If they're experienced, they can go to a 1-to-1 or a high THC product. So there's generally 5 things you really need to know for a patient when you do your recommendation. You need to know the age and the weight of the patient. You need to know their medical conditions and their health status. You need to know what their goals, and you have to know what their previous experience with cannabis is. Because when you know the previous experience, you know where to start and you hit the sweet spot much faster.
Yeah. And also, let's talk about the different routes of administration, because I know when you look at cannabis as a for medical terms, there's a lot of different ways of using it. I mean, it's not like take 2 pills and call me in the morning. You can use it as an oral, which is capsule, gummies. You heard of chocolates, gummies, edibles, sublingual, inhalation, topical. Terel, tell me a little bit about these. Let's start with probably the most popular one to really start with in cannabis. That's sublingual. A lot of people, that's how they get introduced into the use of cannabis, correct?
Well, when I discuss routes of administration, I like to start with what the patient is familiar with. So most people are familiar with capsules. So cannabis is available oral as a capsule, but then edible, right? So let's say somebody takes a dose of cannabis as an edible. So they take a brownie and they don't notice any benefit in 30 minutes. And then they take another dose. They don't notice any benefit in 30 minutes. They take another dose. Now they probably tipped the scale and took too much, because what they didn't know is that it takes sometimes 2 hours for that first dose to work. And so if you're not waiting the appropriate amount of time, you can actually take too much. You won't overdose yourself, but you will get sick, or you will be too high when you don't really want to be high or dizzy or something like that, because you want to start low and go slow. But when you know how each route, how fast it works, how long it lasts, then you can have a great experience with cannabis. We don't want anyone to have a bad experience with cannabis because it's such a great and versatile medicine. So orally is what most patients are familiar with. Now, sublingual is really good because you can just take drops under the tongue or a spray under the tongue. It'll work a little faster. So it'll work with about 20 minutes. It doesn't always last as long as the oral dose, but you will get relief faster. Inhalation is another route that a lot of people are familiar with because their experience may have been from smoking cannabis, or they've seen the vapor pens. And so with the inhalation, you're going to get results pretty quickly, like within 2 to 5 minutes. And you can titrate this, so you can adjust it a lot faster. Topical is probably a little bit more variable. So some patients may notice some benefit within a few hours. Some patients may take 24 hours. if the product doesn't work right away in topical form, be open to dosing it again, but just make sure that you've cleaned your skin in that area, that there's no open wounds or anything like that in that region, and be open to trying multiple doses over a few days, because it may be a little bit slower about how your body absorbs it in the local tissue.
Right. Now, I want to address the issue of flower vapors, the inhalators, the vape pens, the concentrates, because we get a lot of questions on this. I know that when you take that blunt, when you roll a joint, you take that blunt, you go to light it, you take that 500-degree temperature flame, you're burning off about half of the, or about 40% of the cannabinoids, all the terpenes and all the flavonoids. You're reducing the medical efficacy of that blunt about 60%. That's the bad news. The good news is it still can be effective. So what's happened is a lot of the dispensaries, a lot of the producers of medical cannabis products have actually taken the flower and put it in different forms, like the batters, the crumbles, the rosins, that type of thing, which allows you to be able to control the temperature, to use a device where you can set the temperature and bring the terpenes out of that particular product. Why don't you tell us a little bit about that, Terel, because I think really concentrates, if you like to smoke, I think concentrates are really the best way to get the relief when you have situations like neuropathy and you have a problem that you're trying to address. Is that correct?
This is just another way to take your medicine, especially if a patient has some tolerance. So they tried a few products, one-to-one products, THC products. They haven't gotten the results that they need. They need more immediate relief and higher doses. This is one way that there's much more versatility. And so you have flower, you have the concentrates. When you heat them up, now you're getting a higher dose of THC per inhalation, per dose.
Yeah, it's really, really interesting. So I mean, the route of administration, I think, is very important to match that with, as you mentioned, what's the objective that the patient has. Is that correct? Also, let's talk a little bit about how to use it, microdosing and titration.
So when you think about a regimen, so this is the treatment course. So this is, more than just taking the medicine. This is a way of life. You want to think about your diet. You want to really restore health, and you want to use cannabis as one of those ways to restore health. Microdosing is taking a low dose throughout the day and multiple times during the day. Titration means that you're just going to adjust it very slowly. And that's because you want to reduce the side effects, but increase, or should I say, get to the sweet spot faster. So you titrate it, you're going to take a low dose, you're going to know how long it takes to work, and then you're going to take another dose after you've waited that time period. Right. Journaling is just something to do. So you have a journal of what you've tried, what doses, what worked, what didn't work. And so this will keep you from repeating the same mistakes. If you tried something, there's no need to necessarily go back to it. And this is something also that would be good to discuss with your doctor about what was tried, what helped, and what didn't help.
It also helps you identify patterns. When you journal, you can actually see the patterns of, I use this and this is the results, because I think it's important to point out, every person's body is different. Much like your tolerance to alcohol or your tolerance to caffeine, every person's body is different. That's the same thing with cannabis. I mean, tolerance is really important. Tell us about that, Terel.
Over time, your body, no matter what medicine that you take, just about every medicine, you're going to develop some tolerance over time. And that's because your body sometimes down regulates or makes less of the receptors, or the receptors that can actually be pulled into the cell. And that's because the receptors have been stimulated for a period of time. So you may need to switch products. You may need to have a different ratio of THC to CBD over time. Part of that, of course, is going to be based on your body weight, based on your body temperature, based on your activity. But there's no way to look at someone and tell them exactly what they're going to need when they're going to need it. So there is some trial and error, and this helps to come to that point much easier, to reach that sweet spot.
Sure, that's there. Now, what's the bottom line? I mean, we've gone through a lot of things on neuropathy. We've talked a lot of things. I think we want to jump into answering a number of questions. I have some housekeeping issues to take care of before we do that. But really, the bottom line is you're in control. You actually can control how much you take and what products you're taking. Terel, that's an important point.
This is different from just a regular prescription. This is a recommendation. So this is a suggestion that your doctor thinks that you may benefit with the cannabis. And so you can make some adjustments. There is some flexibility. There's not the level of addiction that you see with opioids. You don't see that with cannabis. It's much more similar to what's in our body. The people that get addicted to things are the ones that have a tendency to experiment on themselves and try different things. You can't overdose, and that's because the receptors are not there in the brainstem to suppress your breathing. But if you remember that there's an entourage effect, that'll spark your memory to try multiple cannabinoids and multiple different terpenes to get the optimal benefit with the lowest available, or I would say the lowest effective dose of the medicine.
Right. Now, there's been a number of questions that when you when the viewers signed up for this webinar and the RSVPs, you gave us some questions. We'll answer those in just a moment. But why don't we take a swipe at some of the questions that during the webinar came up? Let's start with Sandy. Does Medicare cover medical marijuana products? Terel, what's your thoughts?
No, this is really going to be more your post-tax dollars. It's not covered by insurance yet until it gets rescheduled. There are some situations where I have seen patients get reimbursed for, with workers' comp and things like that, but it's not covered under insurance until it gets rescheduled and there's more medicines available. The only thing that may be covered at this point, which is, you don't need a card for a Marinol prescription, which that was FDA approved in 1985, and then CBD for rare seizure disorders like Lennox-Gastaut and Dravet syndrome. It might be covered under that. But for the most part, this is not covered under any insurance.
That's one of the reasons why it's important to get medical cannabis rescheduled. Anonymous had a good question. It says, I have chemo-induced neuropathy. Will either possibly help? Terel, your thoughts on that?
So, when we look at different types of neuropathy, chemo-induced neuropathy is one of the most difficult to treat. So for most patients, they may need more than one type of cannabis, meaning not just more than one route, but something in the daytime and something at nighttime. Again, when we talked about reaching your sweet spot, because it is a more difficult type of neuropathy to treat, you may need multiple types of cannabis. And the other thing is, don't forget about other more traditional treatments. So there's a medicine called gabapentin. There's a medicine called Lyrica. There's another medicine called Zymbalta. And actually, for a lot of cases, in a lot of situations, patients need something like Zymbalta to help with that type of difficult nerve pain to treat. Yes, this does have the potential. There's no guarantee that any treatment would help a patient with pain, and that's why we call it medical practice. However, the likelihood of benefit is very high, especially if you have the patients to try different products and find a good match for you.
Right. So this is something that, with respect to the neuropathy from chemo, it's something that could potentially be a solution.
The other thing I would suggest to add is there's a neurogenics treatment which stimulates the healing of the nerves. That's another added treatment that might help. And if you combine those and optimize your nutritional status, it'll give you the best chance of improvement.
Right, that's there. One of the other questions that came up, I know that Terry asked a very interesting question. It says, do storefronts like Trulieve offer combined products for CBD and THC for neuropathy? I'm familiar with the hybrids and sativa offerings, but those don't have CBD components, at least on the label. I think when you find, I'll talk about like Trulieve, when you have ratioed products, 1 to 8 or 8 to 1, that's both CBD and THC, correct?
Right. So like an 8-to-1 product, let's say, for example, the tincture, there's 8 times as much CBD as THC. So there's, for every 80 milligrams of CBD, there's 10 milligrams of THC. That's one example. 1 to 1 is another example. So that means that there's equal parts of each. So for every 10 milligrams of CBD, there's 10 milligrams of THC. So there's different products available. And, just discuss with your physician on even combining different products. So if you have tried a few things and that combination isn't working, if you have your journal, you can actually go over that, and then they can more personalize the recommendation.
Sure, because again, as we mentioned earlier, like alcohol and like caffeine, this is a very personalized type of medication. Every person's body is different. I mean, what I take for my particular pain might be different from what Terel takes, for example. And that's what the journals come into play, and also keeping track of the ratios that work and don't work for you. But I think the important part here to answer that question is when you see that ratioed product, when you see that 1 to 8, 8 to 1, 1 to 4, 1 to 1, those are all CBD and THC combined products. So they're in almost all of the medical marijuana dispensaries here in Florida have some sort of a ratio-based product. Or let's put it this way, the quality medical marijuana dispensaries here in Florida that address medical cannabis all have these particular products that are out there. I know there's one question that was asked by, how do I find a quality dispensary? I think pay attention to the number of ratioed products they have. Is that a pretty good advice? What do you think, Terel?
Yes. And, compare different products, look at the variety of options. So if you think about the different routes, go by your preference, and discuss that with your physician, and be open to, request, other options. So like, let's say you're interested in a tincture, but they didn't give you the recommendation. Be open to having that discussion with your physician that, I understand you recommended that I take this orally, but I'd like to try a tincture, or
Sure.
I'd like to try a vape pen. So just be open to those discussions. But one thing though, with neuropathy, you can have concurrent conditions that may affect how your doctor guides you toward one route versus another. So if
Sure.
you have a certain lung condition, for example, they may guide you, away from inhalation. That's just one example, but there's other examples of that. Or if you're dealing with heart failure or something like that, they may guide you away from smoking. So you have to look at, okay, what is your personal preference, and what are your goals, right? So let's say you're having trouble with pain at night, but you can't sleep through the night. You might take an inhalation, might help you get to sleep, but it may not help you stay asleep because it doesn't last as long. So there you may want to have a sublingual, or you may want to have a edible or a capsule, something that's
I was going
longer.
to say, edibles were great. I know in my particular case, I'm a chocoholic. I take a little square of chocolate before bed. It does take about an hour to an hour and a half to work, but it really gives me that relief throughout the night, so I can get that 6, 8, or 10 hours of sleep that I really need to really help me with my body. I think that's an important part. One of the other questions that came up, Terel, it's an interesting one. It says, why take, Anonymous brought this up, why take CBD or THC when you can smoke the real thing? I have tried gummies and they don't work. That's a great question, because you're mixing routes of administration and the medical therapies. Tell me your take on that, Terel.
If the real thing is buying a product off of the street, then you don't really know what you're smoking because it's not tested. You don't know the concentration, what's in it. You also don't know if there's pesticides, is there heavy metals in there. One problem with outdoor growing is that whatever is in the soil, the plant is going to take up. So it doesn't have a way to get rid of heavy metals. It doesn't have a way to get rid of fungus itself. It doesn't have a way to get rid of those different poisons and toxins that might be in the ground. And you don't want to smoke a pesticide because that could have really devastating effects to your health and you not even know it. So you definitely want to stay with a product that's tested, and it's not tested just internally, but it's tested by a third party. So you have a separate lab that's not associated with the dispensary that is doing the testing. So you can't get bias. So you can't get a skewed information. So it's basically a third party that is testing not only the concentrations, but also the safety of the medicine.
Yeah, and what's fascinating is that medical cannabis dispensaries here in Florida have to do 2 internal tests on the product and then hand those tests over to a third-party lab that's external to that organization to confirm those tests. And those are all available in the label, in the certificate of authenticity that is available for every product. You can ask the dispensary to see that, and they'll show you the tests that have been done. That is really, really critical. What I'm trying to point out here is smoking cannabis can reduce the medical efficacy and definitely take away the key component, which are the terpenes to help you that are out there. Now, fascinatingly enough, a lot of gummies, especially if you buy street gummies, are THC only. They don't have the terpenes, they don't have the flavonoids, they don't have the medical properties. So no, they're not going to work because you're using the wrong product to try to address your situation. Really, really critical is to really identify, what are you trying to achieve? What's the medical condition, and what are the terpenes that you're looking for, and then match the products to that. And again, a lot of people say, well, I'll just smoke a joint. Well, you don't know what's in that joint, and more importantly, you don't know if that joint's going to be able to help you. Terel, you've seen that in your practice a number of times, haven't you?
Well, the same thing can be said for just the purchase of CBD gummies. Well, I
Doctor.
had a patient that took a CBD gummy and he went unconscious. He passed out, and we think it was laced with fentanyl. We don't know exactly what it was, but he had to go to the ER immediately. He
Yeah.
was at home, and a friend gave him a gummy, and it was just in a Ziploc bag. He took it and he passed out. And 911 was called. He was taken to the ER. Thank God that he lived, but it was probably fentanyl or something similar to that in there.
Right.
Um, but with the retail products, so there was a study that looked at the retail products, and it showed that about 60% can be mislabeled. So either they say they have 50 milligrams of CBD, but they have less than that, or they say that there's no THC in there, but there is THC, but it's
Right.
somehow mislabeled. That was a study. It was online, published online, but
Yeah.
it's not regulated. It's like vitamins in the store. They're not regulated. So you want to go to a reputable company. You want to go to a company that does the third party testing to verify what's in it. Regardless, I mean, whether you're talking about CBD or even any other supplements that you're taking, you want to
Right.
have a checks and balances situation where somebody can't just put whatever they want on the label without
Right.
really testing what's in there.
Right. Well, I think the answer to that question that is find a product that has the terpene profile and find the route of administration that can really help you. That'll address that particular situation. Now, if you just want to smoke and get high and you're worried about and buy stuff off the street, that's a whole different game. That's a recreational use and really not something that I would recommend to try to address your medical needs. I think that's really, really important. Let's move on to the next question. It says, in general, what is associated with rapid heartbeat when smoking cannabis, meaning too much THC or too much CBD?
Most of the time it's the THC. So the tachycardia associated with it. So you're basically stimulating and getting a stress response.
Sure.
And so the anxiety associated with that is usually associated with THC. You don't see that with something like CBD.
Right. Gene asked a really good question. It says, what is a good company to buy medical marijuana products from? I know, Terel, this is a softball to you. What's your comments?
Well, I'm the medical director for TrueLeaf, so of course I'm going to endorse TrueLeaf.
Sure.
I think what you really want to do is look at the education, look at the information that's provided. So you want to be with a company that's going to guide you in the right direction. Your physician is going to give you the recommendation, but it's a team effort, right? So it's not just your physician by themselves. It's not just their staff by themselves. There's also the dispensary. And so we have community educators that go out, work with physicians that help us support different events in the community. We have a team that provides educational resources on our website. And I think that is really the key to success in the cannabis is getting the proper education that you need. I would say start with that. And then in the store, when you go to the retail centers, there are associates that can help you and guide you even further and help you get those questions answered on the different routes and the different options that's available.
I know, Terel, when I tend to work in my practice, I tend to work with dispensaries that put a premium on terpenes and educating the customers, or educating the patients, excuse me. And so, for example, this morning, we did a seminar in the villages, and we had not just TrueLeaf, we also had Move, we also had INSA. All three of those companies spend time and pay attention to the terpenes. They pay attention to the ratioed products, and they really have educated community educators that are educated on the particular products themselves. So those are just three companies that are there, I think, that are really effective at being able to provide products that are in the market. There's a number of folks that come along in this market that really don't pay attention to the terpenes. They don't pay attention to the ratio products. They're really trying to just sell flower, and they're really precursors to hopefully getting recreation out there. I have nothing wrong with their business. It's just that if you're looking for relief from neuropathy, pay attention to a dispensary that pays attention to terpenes. Is that a safe bet, Terel?
Yes, because there's a tremendous amount of benefit in the terpenes. It's not just about the THC, not just about the CBD, but if you want to get the most efficacy, the highest amount of benefit at the lowest dose, you have to consider the cannabinoids and the terpenes as well.
Right. Now, Gene also asked a question that says, please tell about the addiction of marijuana. Can you get addicted to marijuana?
You can be addicted to anything. You can be addicted to sugar, caffeine, to Starbucks. However,
Golf.
Cannabis, yeah. However, it's a much lower rate of addiction. Addiction is really, when you think about disease processes, it's more of a mental disorder, and it's where people or patients have a tendency to experiment on themselves. There's a much lower rate of addiction with cannabis compared to other medicines, and there's a lower rate of withdrawal. So separate from addiction is when you stop something, do you get sick? With cannabis, that's not something that you see. You don't see the withdrawal syndromes like you see with opioids, like you see with antidepressants, and actually some of the nerve pain medicines too. When you stop them, you can't stop them cold turkey. You got to gradually wean down on them.
Right. Now, I know that in my particular case, I take medical cannabis because from an automobile accident, I ended up with 7 herniated discs in my neck and 2 in my back. And so there's not a pain associated with that. I'm not addicted to cannabis. I do have to tell you, I take medical cannabis to address the swelling, the inflammation, and the pain. But every 6 or 8 weeks, what I'll do is I'll stop taking it for a day or two just to give my body a holiday, have my body start understand it can't just rely on the phytocannabinoids coming in. It really helps my body reset. But I have found in my particular case, because of the severe condition, after about a day to a day and a half, my neck taps my shoulder and says, you better do something pretty quick because my pain's coming back. So I'm not addicted to cannabis. What I'm addicted to is getting rid of my pain. I think that's what happens with a lot of folks. Is that safe to say, Terel?
Yeah, I see the same question come up with injections because I do a lot of nerve blocks, injections, nerve ablations, spinal cord stimulators, injections for migraines, for occipital neuralgia,
Right.
neck pain, back pain. And patients say, well, I don't want the injection. I might get addicted to it. Well, you're not going to get addicted to it. You're going to enjoy the relief. The relief may not last forever. So you may need another dose. But because your goal is not to get high, your goal is not to be unconscious, there's not the addictive risk that you see with other treatments. Right. And so when you think about addiction, it's like, what is the goal of taking this? So when you look at alcohol, you're addicted if you're taking the alcohol to escape your reality, and now you're getting more toward, mental health when you're dealing with addiction. Where we're talking about pain relief, even with pain medicine, there's something called pseudo addiction. Pseudo addiction is where the patient comes in, they ask for a certain pain medicine because it works, it relieves their pain. It's like they're not addicted, they just want the relief. And It's sometimes referred to as pseudo addiction because it can be misinterpreted as addiction, but the patient is getting relief. They're not addicted, they just want to feel better.
Sure, it's there. Now, an interesting question. Kimberly brought up a question that says, I had a stroke in June. What would be best for me? Now, I do want to point out, Kimberly, we're not going to be giving medical advice over the air. In fact, this is such a personal question. My advice would be talk to a medical cannabis doctor. The answer is it's something that can help you, but we need to know, there's a lot of factors you need to know. I think what type of stroke did you have? Where did you have it? What treatments have you gone through? I think there's a lot of different options that are here. I think we can say that cannabis can help, but Terel, is it safe to say that she'd really need to have a doctor's consultation to really personalize it to answer the question correctly?
When I hear that, there's 3 things you should talk to your doctor with. One is what caused it and how can you prevent it from happening again? That's the number 1 thing. The number 2 thing is what symptoms do you have? So, stroke can cause pain, but it usually takes sometimes a year for that type of pain to develop. And then stroke can cause weakness. So if you're dealing with weakness of the legs, of the arms, you want to be very careful with cannabis because we don't want you to be at risk for falls. And then the third thing is, what is your goal? So you have a diagnosis, stroke. Okay, what is your goals for taking the cannabis? So I would discuss those 3 things with your doctor. What caused it and how can you prevent it? The next thing is, okay, now we know it happened. What can we do to reduce the risk of other problems? So with cannabis, you want to start low and go slow. So if you're having weakness in the leg, we don't want you to start with a high THC and get balance problems and get injured. And then the last thing is, what is your goals? So what is your goals of treating either the stroke symptom or what we call sequelae, what's left over? So talk with your doctor about those 3 things. And, hopefully, if you are referring to stroke related pain, you start with maybe a CBD or high CBD ratio tincture, oral, something that lasts longer, because in general, that type of pain is difficult to treat. It does tend to last longer and you would need a longer pain reliever. But I would say talk with your doctor about those three things when you're dealing with stroke, because there's like Mark said, there's so many different things. Where the stroke happened in the brain. Did you recover fully from the stroke? Are you still having some deficits from the stroke? Are you having pain? Are you having weakness, numbness?
Right.
But the main thing is, look at a preventative strategy from it happening again or getting worse.
Yeah, and the answer is it can help, but really consult the doctor. He'll be able to personalize and get that question answered for you appropriately. Linda had, so it's the last question we had from the seminar itself, that we're going to jump over to the questions that were asked by the patients coming into this. How can I find a doctor knowledgeable in CBD and THC? That's a golden question. Is that correct, Terel?
So there's actually informational resources we have on our website at TrueLeave, and you can scroll down to the bottom and it says how to get a medical marijuana card. And it has a link to physicians that's available in Florida. And once you click that link, it has a map to physicians that are qualified. So in order to give recommendations in Florida, physicians have to take a course, and that course verifies that they can understand and know what the risks, benefits, and options are. And then once you do that, I would say call up a few of the offices and just tell them what you're dealing with and you'd like to schedule an appointment.
Right. I think one of the other things I found is pay attention to the medical cannabis doctors that speak at conferences or that speak in general and do seminars. Those doctors tend to be ones that really are more knowledgeable about cannabis. And I'm going to defend the doctors when they first get involved in this, because they really weren't taught the endocannabinoid system in medical school. There's a little bit of research that they have to get in this particular space to do an effective job. So I tend to look for doctors that have spoken at conferences, that have presented papers, and that really are there to have been vocal about relief for using cannabis for relief for various conditions. They're there.
When you're dealing with neuropathy, you should also have a pain physician that you're working with as well. Somebody that specializes in that, they're specifically trained in pain management. So that way they can help fill in any gaps in treatment. Cannabis is just a component. It's one of the modalities of treatment, but to have the best outcome, you want to address the pain in several different ways. So that with your physical therapy, with your injections, you may need other medicines to supplement the cannabis as well. And you want to talk to your specialist, someone that is trained specifically in pain management, is knowledgeable about the pain pathways. Yeah.
So let's jump into some of the questions that were brought up by the viewers when they registered. I do want to point before we do that, there's a site called IGMLB, I Got My Life Back. If you have a medical cannabis story, please go out there and tell us about it. And this is a site you can go to that you can see what people's experiences they've had with medical cannabis. We're trying to build a resource so people can look at what's going on with the condition that they have, and what are some of the resources and some of the outcomes that people have had. And I also want to mention, as Terel mentioned earlier, CBD products are not regulated. So where do you find regulated products? Where do you find products that have been tested? I know that I work with MMTC of Florida, which has 25 doctors' clinics here in Florida. We actually were confronted with, how do you find a quality CBD product? So we researched 135 products and came up with 2 different brands, one of them being SunMed. SunMed follows the same process that most of the dispensaries, in fact, all dispensaries have to go through. They do 2 internal tests and then 1 external test to make sure that the products have the quality that's there. They're probably the most rigorously tested CBD products that are out there. And then we offer them through My Botanical Wellness. You won't find hemp-based CBD products in the dispensaries. This is where you can find that, and this is where it can help you be able to address be able to find that as a resource. And you'll get a coupon code of MMWW15 to get a discount on that. And I do also want to mention that we're doing anxiety and stress next week, followed by improving sleep, terpenes, and dosing. I think Terel, you're going to help with the terpenes. Is that correct?
Yeah. So I was taking a bite of dinner. Now, one thing about anxiety and stress, I want to say, that goes hand in hand with pain, because pain is an unpleasant sensory and emotional experience. So this is a very good webinar to attend, especially if you're dealing with pain issues.
Right.
What you also want is a meditation program. So you want to maintain lower stress levels. And so when you think about meditation and what you can control, when you're stressed, you almost lose control. Controlling your breathing, that's where you want to start. And then over time, as you meditate, you're going to find that you can separate your mind from your body. And so you can actually separate the pain that your body is going through from the mind. And, when you think about meditation, You want to continue to practice it to get good at it. It's not something that you just start and you're a master at it after 2 or 3 weeks. You want to have a good regimen. And then you have improving sleep here. Of course, the cannabis, we talked about ways that it helps with sleep. Very important for pain patients. With the
Terrell, and I
terpenes,
also want to point out Dr. Greg Holt, who's a sleep specialist, is joining us for that particular webinar. He does a great job in this. It's if you have trouble sleeping, that's a webinar you want to take a look at. I'm sorry, I didn't mean to cut in, but I think sleep is critical to maintaining your health.
that next one with the terpenes, my preference is to talk about a lot of research because I feel like there's a big gap in the research that has been presented and the amount that's out there. There's literally hundreds of papers on terpenes, thousands of papers published on terpenes, but we really need to take a more scientific approach on that and reference some research papers so we can really fine tune the cannabis recommendations.
Mm-hmm.
And then the last one on dosing, everybody wants to know about dosing, where to start, how to hit the sweet spot, what route to take. So I don't think I'll be participating in that particular one, but I think all of these topics are really important, especially as it relates to pain patients.
Terrell, you're always welcome to on any of these webinars. You know that we've worked together long enough on that. Now, I do want to talk about. There's some questions that come up. Some of them we've already answered. These are the ones that were pre-submitted that were there. You want to take we've answered some of them. Do you want to address some of these, Terrell?
So are there topicals that can be used to treat neuropathy? Yes, there are. Topical formulations of CBD and THC. I would recommend to consider supplementing that also with a lidocaine topical. So lidocaine is a local anesthetic. And so try to develop your own entourage effect. Use not only the cannabis, the CBD and THC products, but add your own topicals on top of that. Lidocaine is now available 4% over the counter.
Mm-hmm.
What is this? Interested in low THC to no THC options. So there you're going to get just a pure CBD product or something like a 20-to-1 CBD to THC or 8-to-1 CBD to THC. Yes, there are plenty of low or to no THC options. The best
that's that ratio product. That's that ratio. Go ahead and look for the ratio product. When you look for ratio product, the first number is CBD, the second number is THC. So you're looking for the first number to be significantly larger than the second number.
Best medicine for chemo-related neuropathy. I mentioned earlier Zymbalta, duloxetine as one medication, and usually before you've gone to that, you've tried something like gabapentin and Lyrica. That is one of the most difficult types of neuropathy to treat, but I mentioned earlier combining that with the neurogenics, which is a nerve, it helps stimulate nerve regeneration. But then also your supplements are very good for neuropathy, magnesium, B12 to stabilize nerve activity. Because it's so difficult to treat, usually you need a combination of several different medicines for chemo-related neuropathy. I'll let you take the next one, Mark.
What's the best treatment for neuropathy in the feet? I can't feel the bottom of my feet. Well, we talked about a number of options that you have. I think the best treatment, again, goes to what you're comfortable with. I would consult your physician. And I think the question, as Terel mentioned in the beginning of the slides, there's physical therapy, there's injections, there's a number of different options. I think the best treatment is the one that, first of all, that you're comfortable with. Some people are into physical therapy, some people aren't. I know that's something it's a touchy subject. I personally like physical therapy, but there's some people that really want to stay away from it. I think especially when it comes to your feet, what you really want to do is you really want to be able to have something where it concentrates on that particular part of the body. Again, look at the different terpenes that you're going to be needing. If you're looking at cannabis as an option, if you're looking at a plant-based option to really address that, look at the terpene profiles that are there and make sure that you have the strains that match that. Is that a safe approach to take, Terel?
Yes. Yeah. One of the best treatments is really just to actually even try to avoid neuropathy in the first place. The most common thing that causes diabetic neuropathy. Right. So whatever you can do to control your glucose levels, I would say, start with that as far as lifestyle. Mm-hmm. And, when you can't feel the bottom of your feet, we talked earlier about hypoesthesia. You are at risk for getting cuts and infections on your foot. It's important to check the feet, throughout the week. You may even want to check it every day. Mm-hmm. I used to tell my dad, when you get down on your knees to pray at night and in the beginning of the day, also check your feet while you're down there to make sure you're not having any cuts or any signs of infection there. When you can't sense
Right.
that area, you don't know that you have a problem that needs to be dealt with.
Right.
But with the cannabis, it is one of the tools. It's not the only tool, but I would say, look how you can combine that into your other treatments as well.
Right. And what products are best? Well, we recommended some, or we actually came up and researched and found some of the strains, some of the cultivars that make sense. I would start with those particular products and see if they can help you there. I think the issue is not just the product itself. The other question becomes, what's your more comfortable route of administration? Is it inhalation? Is it using the orals? Is it using the tinctures? Is it using the topicals? I would say, topicals are something that could really help with neuropathy if you have the right transdermal products. That's safe to say, Terel?
So interrupting the pain pathway, topicals is a great way. The more ways you can interrupt the pain pathway, the more likely you are to get benefit.
Mm-hmm.
But that is a good starting point. With the topical, then add what we call systemic. So systemic is, taking something that goes throughout the body. A lot of the receptors and how the medicine works is in the spinal cord and brain.
Mm-hmm.
So you do often, need that, what we call systemic, to where the medicine will get everywhere. But topicals is a great complement to the other routes of administration.
Right. Terel, I'm going to let you take the next question about how to calm the attacks.
How does marijuana calm myasthenic attacks? So, a myasthenic attack, myasthenia gravis is a syndrome that causes weakness, and it has to do with the receptors and the nerve cells and how nerves connect to muscles. And when you have an attack, you could have droopy eyelids, weakness, inability to focus because one eye is weaker than the other, where the muscles around the eye are weaker than the other. And the way it would help would be more of an indirect. There are some case reports where patients have had less attacks when they take cannabis, and it probably just has to do with maintaining homeostasis. I wish there was an easy treatment for myasthenic attacks, but that's definitely one where you want to see a specialist. You want to see your medical marijuana physician, but you also want to see a specialist when you're dealing with something like that, because it is a severe neurologic condition. So you want to make sure that the neurologist is following you as well.
Sure. Well, here's the last set of questions. I know we've been on this for quite some time. So let's see if we can wrap this up and answer some of these questions. Talk about the diabetic use, talk about the use of medical cannabis to address diabetes. So
diabetes can cause neuropathy, is the most common cause of neuropathy. It's not a qualified condition to take it for your blood sugar. So that's not what we're talking about here, but contrary to what most people think or what might be popular, cannabis does not cause a huge increase in appetite. If you look at the people that consume the most cannabis, Snoop Dogg, Wiz Khalifa are the two that come to mind. Neither one of them are obese, but it can suppress to some degree if you're having cravings for certain sweets or things like that, because it does help with the stress response. Indirectly, helping with the neuropathic pain is probably the most common thing that we would see here in Florida. The most direct way to help would be to control your blood sugar. And of course, we always say lifestyle changes, talk with your doctor about making adjustments. So this is one where you want to have a specialist for your diabetes, but then you also your medical marijuana recommending physician, which may be different physicians.
Yeah, that's there. Can marijuana help with restless leg syndrome?
The way it would help with restless leg syndrome is, one, by helping the pain. With nerve pain, you have a sense that you want to move your feet to kind of distract you from the pain. Is also an insomnia component to that as well. So your more sedating types of cannabis, the ones with beta-myrcene, the higher ratio THCs are going to be the ones that are most likely to give the benefit with restless leg syndrome.
Mm-hmm. Yeah. Now, the next question is interesting. Says, I have kidney disease stage 3. Is cannabis kidney friendly? And says, I vape daily and use edibles occasionally for sleep aids. I'll let you take that one. That's right up your, that's in your wheelhouse, Terel.
Well, I would imagine that that's from diabetes, because, diabetes is one of the conditions that's going to affect both the kidneys and cause neuropathy.
Yeah.
So the good thing about cannabis is it's not like non-steroidal anti-inflammatories where they can affect your kidneys. So that's one thing that you would want to discuss with your doctor to avoid, because you don't want to put yourself into a situation where you lose the little bit of kidney function that you do have.
Mhm.
In many cases, medicines do have to be adjusted when someone has kidney disease. So if you're concurrently taking something like a gabapentin, make sure you discuss that with the physician that's doing the recommendation for the gabapentin or for the other nerve pain medication. The advantage of the vape is that that can provide more immediate relief. The edibles last longer, so hopefully that will help you sleep through the night.
Sure.
You know, cannabis is not known to adversely affect the kidneys or the liver, and that's because there's so many anti-inflammatory components. And what is even more helpful is where you're not taking it as where you're smoking it, because smoking can, you know, cause you to have carcinogens. It can also increase your carbon monoxide levels, and that's not going to be good for any of your organs.
Right.
So it probably is better to have a more milder, more, I would say, lung-friendly approach with the vape compared to the smokable. And edibles is good because that will be longer acting.
Right. Now, the next question is interesting. It says, I need help with depression and anxiety, and I'm going to throw a shameless plug in, having them potentially have them watch our webinar next week. It'll address the anxiety and depression that goes along with it. But medical cannabis can help with both of those conditions and is really something you should take a look at. I would recommend, if you need help, find a medical marijuana doctor, talk to them, get your card, and then find yourself a quality medical cannabis dispensary. As we mentioned earlier, we gave you the names of 3 of them. Find a dispensary that can really help you with those particular products. I think, Terel, you've seen this in a number of patients. Medical cannabis is an option, but again, get a doctor, make sure you get the right terpene profile, and make sure you get the right products. Is that a safe approach?
So with pain is an unpleasant sensory and emotional experience. Cannabis can help with the emotional experience, which can be depression or anxiety. You know, limonene, for example, is one of the terpenes that helps to stabilize mood. If you're dealing with depression, you may want to have something that kind of helps you, you know, lift up, helps you have energy. When you're dealing with the anxiety, you want something that's going to relax you. So you may have different types of cannabis within that regimen.
Cool. One interesting question: is it possible to regenerate nerve cells or cure diabetic or chemo-related neuropathy?
Actually, I did a TV interview on this at the Players Championship golf tournament. So if you search Dr. Newton Players Championship Neurogenics, it will probably come up NEUROGENX. That's one way to stimulate regeneration of nerves. Also, nutritionally, you want to have magnesium. You want to have your B vitamins as well. You want to also be well hydrated, because nerves do require a lot of energy, and they do require hydration as well. With the cannabis, it will certainly function as a neuroprotective antioxidant. Now, whether that occurs peripherally, so the patent that the National Institute of Health has is cannabinoids to protect the brain. So does that help in the peripheral nerves? We don't know for sure, but it has the potential to do that. Is there research on it? No, there's not research on that yet, but it has been shown to protect the nerves in the brain. I would say ultimately, you know, what you want to do is prevent it from getting worse. So if you're talking about diabetes, controlling the diabetes, that's going to be ultimately what gives you the best potential. If you have chemo-induced neuropathy, you know, hopefully the chemo has been completed, and, you know, so you're not continuing to expose the nerves to the chemotherapy. And hopefully that treatment was successful as well. But that combination will certainly give you the best chance of regenerating the nerves.
So one of the next question is more political, so I'll answer it from a political standpoint. You know, it says other states either give deep discounts, or like West Virginia, no charge for licensing and expenses. It really depends on the program of the state. You know, each state program is different. That's why you have to get a card in each of the different states. I'm going to not here in Florida, there's a lot of things that we do well, do very well. There's a lot of things that we don't do well. I think the price of the medical marijuana card is way too high, and something should be done about that. Again, that goes back to just addressing that. It should be more addressed with your representatives in Tallahassee or in the state that you're in, to make sure they understand that the costs are really important, and to make sure they have a quality program. It's really varies state to state, and I would love to see more discounts, and I'd love to see more options here in Florida. But unfortunately, the politicians in Tallahassee, especially the current regime, are not cannabis cannabis friendly. In fact, if they had their options, they would get rid of medical cannabis. So putting pressure on the politicians, putting pressure on your representatives is really, really critical to be able to answer and to address that particular issue. Next question that comes up is, what products are best to reduce pain and to allow sleep? I think we've talked a little bit about that. You want to give a quick answer for that, Terel?
Yes, so we reviewed the different cannabinoids, THC, CBD, CBN. That's one area that might be new to you, is the CBN cannabinol. The other thing that we discussed, which may be new as well, is the beta-myrcene. That tends to be a sedating, relaxing terpene. So that combination could be one that might work well for you.
Right.
The other one is limonene, which is very good for nerve pain as well. The main thing is to get a hold of the pain. And then the second thing, you can also take cannabis with effects on sleep. So you can treat both at the same time when you're working with the cannabis medicine.
Sure. We did. I know we've answered these questions. There's a couple of questions that came in at the end, and I don't want to make this webinar too long, but I do think there's some good questions that came up. I'm going to take a quick one here. Gene asked the question, would you please repeat the name of the dispensaries? We talked about True Leaf, which is one. We talked about Move or Verano, which is another one. And the other dispensary that I'd like to talk about is INSA, I-N-S-A, which has an interesting name. It was shortened for Indica and Sativa. So those are the three dispensaries that we had mentioned a little bit earlier. One question that came up, Terel, which we may not be able to answer, it says, what if my physician wants to give me prescription? Are there physicians in New York? And New York does have a medical marijuana program, and I think you really need to go to the local dispensary and look at the directories up there to really find that particular doctor. I'm not sure we can answer that right now. I just don't know of one. I think you'd have to research that a little bit.
The question, what was the question?
My physician wants to give me a prescription. Are there physicians in New York? And I think, again, you have to look at the New York medical marijuana program and be able to research, go to the medical marijuana office of medical marijuana use, and they should be able to lead you to some physicians that are there. They can help you.
So most state programs are run by the Department of Health. So that will probably be a starting point to check the New York Department of Health website. And then the next step from there might even be a Google search on, what physicians are giving the recommendations. And I would suggest to call a few of them. Don't just, the first one that pops up, the one that's marketing the most, compare and contrast. Ask about the experience. And if you're dealing with a specific condition where you're seeking it, ask, do they have patients that have been dealing with this issue? And so any physician is going to be better the more experience they have. So, if someone has qualified 5 patients, and you compare that to someone that has qualified 100 patients, hopefully they're even more experienced, better, after they've qualified 100 patients. So that is something else that you want to look for when reviewing and researching the physician options that you have. Sure.
Roseanne asked a really interesting question. What strains cause or make neuropathy worse?
I've not known any strain, any chemovar to make pain worse. One thing that you want to consider, though, is that there's something called a biphasic effect with cannabis, meaning that after you hit your sweet spot, if you keep taking more and more, you can start to see less efficacy where it's not helping as much, but it's very rare. And I've not heard of any condition where the cannabis is causing pain. So you want to just, start low and slowly increase. That will prevent you from losing efficacy, meaning that it's not helping as much.
Yeah, you brought up a really good point, and that is that if you take too much of it, you get past your sweet spot, and it starts bringing that pain back. So I would just say scale back on the amount of cannabis that you're using, and see if that helps. Is that a particular option? Anonymous asked a really good question, and probably the last question that we'll take. Is there a difference between ALA and R-ALA?
Is there a difference between what?
ALA and R-ALA.
I'm not familiar with R-ALA, so that's something that you have to look up to see what your resource is.
Yeah, I'm not familiar with it at all, so I'll let you.
ALA is alpha lipoic acid. I don't know if this specifically means like an R isomer. So there's different chemicals that have what we call enantiomers. So sorry, I'm getting too technical here, but enantiomer is basically mirror images of a molecule. And so
Mhm.
that's one instance where we do use an R before a
Mhm.
dash, but I'm not certain because I've not seen the actual article that's being referenced. But that may be what it means. And I would just say, just print that article out, bring that to your doctor or your next appointment with them. But ALA is alpha lipoic acid. That's a very common a very common supplement that's often recommended for neuropathy patients.
Great. Well, Terel, we've been at this for quite some time. I think I want to wrap this up. And first of all, I want to say thank you for everyone who's still here watching this. Webinar has gone quite some time, but if you take a look at it, we've gone almost an hour of questions, and hopefully we've answered your question. The goal of these webinars is very simple. Our goal is to be able, if we can make just one person's life better, if we can give one person help one person get their life back, then we've accomplished what we wanted to accomplish. So hopefully that's been able to do that. But I want to thank everybody for tuning into the webinar. Thank you very much. Please tune in for the rest of the webinar series that we've gone to. But Terel, do you have any final questions and thoughts?
Thank you. Really, that's really it. Just thank everybody for listening. Thank you for your questions and look forward to the next one.
And Terel, thank you for your sage advice. Let's put it that way. It's been really great. Thank you, everybody. And hopefully I'll see you next week for the anxiety and stress webinar. Again, you'll be getting a copy of the video. You're getting an email from us that has a copy of the video. It has a copy of the presentation, a number of discounts from the dispensaries, and other follow-up information. So thank you, and everybody have a good evening and have a good weekend. Thank you very much.